Over 200 years ago, there was a revolution, an American Revolution, an event that literally changed the course of history. It was led by a group of unsatisfied people. People who were tired of being told what they could do and when they could do it. People were fed up with their lack of choices and their lack of personal freedoms. People fed up with their lives being controlled by others. Fed up with being oppressed, fed up with being manipulated. They finally said, enough, I've had it, and I'm not going to live like this anymore. Our ancestors were people that took full responsibility for what happened to them. It was that spirit that ignited a country and formed what is now a giant in the free world.
Election 2016. In a series of in-depth discussions, we're taking a closer look at the issues that affect the region, the economy, healthcare, infrastructure, and more. Where do the candidates stand, and how does it affect you? In this episode, we're talking about healthcare, access, quality, and the rising cost.
In other news, since the beginning of 2010, around 50 rural hospitals across America have shut their doors, making it harder for millions of Americans to get the health care they need. But while these closures have happened across the nation, the majority have been concentrated in states that have failed to expand Medicaid under Obamacare. Take a look. As you can see, the majority of rural hospital closures have been in states like North Carolina, Georgia, and Texas, all states that have not expanded Medicaid under Obamacare. And while all of these closures hurt, some hurt more than others.
I think we have to be responsible with taxpayers' money. I think we have to make sure we do what I did with an executive order with regard to rural hospitals. Allow them to cut back to the services they can provide and not lose their certificate of need.
There are a number of reasons more rural hospitals are losing money, such as increased operating costs and declining reimbursements.
Everybody in this country needs to be praying for these rural hospitals.
Well, a new attitude along with some creative financing is helping some Oklahoma towns save their local hospitals. Our Lisa Hines visited Drumright, where local residents are investing in a healthier future.
Last week, we brought you a story about the many rural communities in the country affected by a recent wave of hospital closures. Tonight, special correspondent Sarah Varney takes us to Fredericksburg, Texas, population 10,000, where a hospital is bucking that trend. Its turnaround is seen as a model for other rural hospitals struggling to keep their doors open.
When the Drumright Hospital closed in 2001, residents knew without a medical facility, they would suffer both a medical and a business hardship. So they decided to do something about it.
Sometimes getting to the emergency room quickly means the difference between life and death. That's why people in rural areas are worried about their small-town hospitals closing. As Lori Johnson shows us, they're not taking the news sitting down.